bariatric surgery is weight loss surgery, which I've been doing for the past 15 years, initially in the UK and since I've come here to the Bonds in 2008. The incidence of obesity in Ireland currently is between 25 and 30%, and the incidence of morbid obesity is around about 2%, so roughly 2% of the Irish population currently would be candidates for bariatric surgery.
A big part of my job is the area of diabetes. I suppose diabetes is becoming more and more prevalent throughout Ireland and throughout the world. So I'd work in the area of type 1 diabetes and type 2 diabetes.
I came looking for a gastric band, but Mr. O'Boyle went through the various types of surgery with me and he recommended a gastric bypass for me, and he explained why. And that's what I went with, and I'm glad that I did.
Yeah, he'll go through the different procedures with you at your consultation. So at consultation, he'll go through all the different procedures going on your medical history, and he'll decide with you in consultation then what he thinks is suitable for you and recommend that.
What we would be trying to do is trying to assist the individual to make positive lifestyle choices and set and achieve realistic goals for themselves.
Patients who've been drastically overweight for many years, who suddenly can lose 10 stone in a short period of time, are extremely grateful. Their quality of life is dramatically improved. So that was the major impetus for getting into it and staying in it. It's a very rewarding surgery to do.
I was a professional dancer, so I'm back dancing and back playing tennis, and I absolutely love it. You know, it's just great to be able to go out and do those things again, because you get to a stage where you just physically can't do them as much as you want to, you just physically can't.
I would link in with most of the departments in the Bonds. We have a multidisciplinary team. Before any patient undergoes surgery, we all sit around the table and discuss them, so I will liaise very closely with the dietitians. There's obviously a dramatic effect on diet following this kind of surgery. The physiotherapists have a physiotherapy program for all the patients. I have close links with the cardiologists. Any patients with cardiology problems will be discussed and referred. The endocrinologists, my patients will be diabetic and are actually coming for their diabetes to be cured. There's about an 80% cure rate of diabetes following gastric bypass. It's very much an integrated team management sort of subspecialty. So we're all pretty highly qualified, and I'm very happy that the standard of the hospital is as high as you'll get anywhere in Ireland.
For me, the major change that I noticed initially was medical. My diabetes cleared up completely within months. I was on a huge amount of medication for diabetes. I'm on nothing now, and 2 years down the road I'm still on nothing.
You definitely get a lot of job satisfaction from it, especially even from the likes of bariatric surgery. When you, on a particular, let's say, longer bariatric journey, you meet them on day one, when very often they say they're at the end of their tether. They've tried all these different diets and they really are at a very low point. As time progresses, day one post-surgery, day 14, day 30, you really do see them blossoming as they progress through the bariatric journey, and it really is very, very fulfilling.
Job satisfaction is very high, patient satisfaction is very high, feedback is great. It's great to work in such a positive institution with positive individuals.